Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high-risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Today, we'll be talking with Cherish Hockey. She was born and raised in Michigan, where she attended Ferris State University. She first touched a transducer in 2003 at the age of 17 and haven't once questioned her career choice. Over a decade of MFM experience, with the majority of it spent as a preceptor and/or lead. Currently employed by a clinician-led company called Excel Telecare as an advanced practice sonographer specializing in maternal-fetal medicine and OBGYN for over 3 years. Please help me welcome Cherish Hockey. Thank you, Cherish, for coming back and becoming another a repeat guest on our podcast.
Thank you so much.
You are very welcome. I appreciate, I think last time when we talked about preceptorship, I really appreciated your vulnerability and when you were sharing. And so I just think that's how we grow as people. And so learning from other people's mistakes is kind of what we try to do in ultrasound. And so
That way you don't have to do it yourself.
yeah. And that's why we tell you, I do it a certain way, right? And everybody has their own certain way of doing it. It's not wrong. But our objectives today are to talk about the role of an advanced practice sonographer, and how it is used in telemedicine as well. And Cherish has some good experience in regard to this, and I think she shared this at an STMS conference. Is that right?
Yes, I did at the virtual conference that goes along with their in-person conference, as well as during Crunch Week last week.
Awesome. So yeah, this will be a good review if you heard it from other places, but it'll be new information to a lot of you.
Yeah.
So tell us a little bit about yourself again, and just keep us updated as to how many years you've been in ultrasound and what you've been doing.
I hit 20 years working in ultrasound this past year in 2024. Started off in general ultrasound, kind of dabbled vascular surgeons, outpatient, inpatient, small hospitals, big hospitals. Found my way to the first job I could find that did not require call. And that was MFM. And so lucky that I loved it and found my niche, because I've been there now for 12 years.
That's awesome. That's awesome. So we're going to just use her outline that she used in STMS. And so one of the first things she did was just help us to define the stage and define different terms in regard to, there's a lot of different terms as far as like telemedicine, remote working, different things like that. So can you go over a few of those with us?
So remote work is really any work or any job that you can perform that you don't have to physically report into a location. This is a job that you could do from anywhere that you have reliable internet, really. So it could be from the comfort of your home in a home office. It could be, your patio, as long as your Wi-Fi is reaching that far. It could be on a plane with plane Wi-Fi in a hotel. You could use your mobile hotspot, whatever works for you to reliably access the internet. Um, and some jobs you don't need to be even plugged in all day. You might be able to do some work offline, so you could really go wherever you want and work.
Awesome. Awesome. Tell us a little bit about the four different kind of facets of telemedicine.
There are four major facets of telemedicine. Um, but in terms of imaging and radiology, teleradiology is the main one that we would be considering. There's also live video conferencing. Live video conferencing, which is kind of, what people think of when they think of telemedicine, like screen talking to patient.
Right.
And so the company I work for, Access Telecare, that's kind of their bread and butter. They provide specialty care to hospitals that don't necessarily have specialists on staff. So really, providing access to care to more rural communities. So that's live teleconferencing. Teleradiology is an aspect of telemedicine where captured or stored patient information is transmitted electronically and typically reviewed at a later time, although there are folks doing live review. There's also real-time remote monitoring, which can be used with like a virtual sitter or monitoring patient vitals. These are like people sitting with, 8 monitors monitoring all kinds of different information. Big hospital systems like to outsource those kinds of things. So that's another facet. And mobile telehealth is the fourth and fastest growing facet of telemedicine at this time. So people, having a virtual visit on their phone, essentially.
Yeah. So I remember back in the day when we were begging insurance companies to pay for that, right? For
Mhm.
people who would come in from very rural areas and spend hours of travel just to get there and then to get back. And
Or having to provide outreach to these communities and, having to pay folks to commute their time and their gas, et cetera.
right. And so insurance was so resistant to that at the time. And then COVID, if there's anything positive that came out of COVID, it was that, right? That, okay, now
Absolutely.
we can do remote work.
Yes. Yes. And COVID-19 definitely, in terms of insurance reimbursement, really kind of brought a lot of things to light, and a lot of space for growth in telehealth, and financially, with bolstered reimbursement for telehealth, really has helped the industry to grow.
Yeah, and provide more opportunities, right? For us to be able to work from home and different
And
things.
as well as for patients to receive care. Absolutely.
Right, right. Absolutely. You've got some numbers here, like half of people who you started using telehealth services really enjoyed it and
Mhm.
really wanted to kind of continue with it. And
Mhm.
so, and then doctors even now feel a little bit more favorable with that. I think
Yes,
I certainly feel that way. I think it still has its limitations. It'd be nice if you didn't have to be in the state to speak with your doctor, right? Like
true.
for me, who is out of state from my regular physicians, that would be, an advantage. But nonetheless, it's still a very highly favorable for both patients and physicians.
Yeah, and I mean the biggest glaring limitation of telemedicine is that you can't physically lay hands on a patient, right? So
Yeah,
that's
and
going to be
so
the single biggest drawback to
right.
telemedicine. So anything that needs physical contact, physical touch, physical examination is just automatically not going to be a candidate for a telehealth visit.
Yeah, which is kind of unfortunate, right? I think we're getting really away from that. Um I remember I had a friend who had ovarian cancer, stage 4, and had fought it multiple times, went with another friend to go visit her. It looked like it was getting near the end of her lifespan with that. And, a nurse came in and there were people in the room and she just like scanned the medicine, scanned her wristband, and she was out of the room. Like back in the day, they used to like tuck your blankets in or at least touch you or something to know, like the patients don't always know that they have a fever. And maybe you notice that or something of that nature. Um, so a little bit of a disadvantage, but
Yeah, a little bit of a disconnect there certainly can be.
yeah. But overall, I think if you have an established care with a physician, doing a follow-up through telemed is amazing, right?
Absolutely.
Yeah,
Absolutely. And if it's care you couldn't get otherwise, like for example, a cardiologist.
right,
You went to your local facility and had a had an echo done. And maybe your closest cardiologist is like 100-mile drive away, which you live in
oh,
Colorado, you're currently in Colorado. You can see how in these tiny mountain towns that's a very big possibility and could be dangerous even to commute, try to
right,
make that commute. Um, so I worked at this little tiny hospital outside of Telluride, and that was a situation we had where we could do the echoes for them. We didn't have a cardiologist on staff, so we would remotely electronically transmit these pictures to a cardiologist in Grand Junction, and they would be able to read them and get the results back to these patients. So these patients didn't ever have to make that commute. They were able to stay, in their community where they feel safe and comfortable. And that's just a really huge boon to the community, especially for vulnerable folks who don't need to
right,
be on the roads, especially in a place like that.
right. And for a technologist to take call, I mean, we're very aware of telemed, right? That's been going on
Yes.
for years and years.
Not a new concept.
Not a new concept at all.
Nope.
And one that was very frustrating to us as technologists, right? Because we're the ones coming in for it. The doctors are rolling over out of bed for it, you know?
Yep.
Um,
Or
so
in some cases they're licensed in that state, but they work, 4 time zones over. So they're sitting on their patio in their, in their boxers, like
right, 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 you know? So we used to get pretty frustrated, and now it's just a way of life, right? And
Mhm.
being able to troubleshoot those telemed issues at 2 o'clock in the morning too was another issue. And we probably don't have that as much, right?
Right.
And back in the day, we used IT people would have to go to the physician's houses and install certain
Yep. Now they
equipment.
just ship it over, and if you can't set it up yourself, you're not fit for the job.
Right. It's pretty simple, straightforward right now, right?
Yep.
So, yeah, so that's is definitely a benefit.
Yes.
You say here that more than half of rural countries have no hospital-based obstetrical services and are considered maternity care deserts.
Yes.
I will have a guest later on, hopefully this month, that talks about that. He was a radiologist and he is now serving underprivileged areas in different countries with OB care. And it's kind of sad, and I think I've mentioned this in other podcast reviews as well, that, in the US, we don't ever think that, well, what do you mean nobody else has this kind of care,
Well,
in
and
other
also on
countries?
that slide, it does talk specifically about the US and how these rural hospitals have been closing more and more frequently. Um, and so it is actually a very surprising number of rural countries here in the United States that don't have maternity care either.
Yeah, you say 1 in 3 women, right? And that's kind of an alarming number.
But yes, and that can be for a variety of reasons. You might live in a big city like New York City and have, healthcare, on every corner. But if you can't read the language, if you can't afford the bus ticket, or there's so many barriers that could present themselves. If you don't have insurance and you don't know how to go about obtaining insurance, you don't qualify for Medicaid and you can't afford things otherwise. There's so many barriers that can prevent healthcare for women in the United States.
Yeah. Yeah, they're still there. So tell us some benefits to telemedicine and how it helps with care.
So ways telemedicine can help with access to care. Really what I can speak to here is what the company I work for does. And I work for a company in their MFM department. And so some goals that this department has is to increase the number of local deliveries, right? So if an MFM can see you in your local community and, get you hooked in to the right channels and networks, you might not need to go to a big city to deliver. You might be more likely to be able to stay home and deliver, close to home where your family, friends, your whole network is already there. It can also improve perinatal and maternal outcomes by having accurate diagnoses. You know all about this before delivery. Do we need a NICU? Do we need surgical teams? Do we need neonatal units, et cetera? Do we need access to, prematurity things, which is a growing number of hospitals don't have. So having those accurate diagnoses made by an MFM physician from the comfort of your own home community is huge.
Right.
Just decreasing windshield time for patients, so they're not having to drive, 180 miles one way, in rural Montana to go to see an MFM. That's huge. We don't even need to talk about the risks of driving a car, let alone while you're pregnant. And the huge benefit.
In an ice storm,
True.
kind of winter time here where I'm
Yep.
at, and there was an ice storm and people would drive, and she's like, oh my gosh, there were 3 cars turned over in the ditch. And my husband was like, maybe we should turn back. She goes, oh no, I've been waiting for this. We need to go. And I'm like, okay, that's called pregnancy brain,
I was
right?
about to say
That's not
pregnant
a
people and elderly people,
reasonable.
they're going to show up no matter what.
Right, right. That's not a reasonable way to look at that.
Yep.
But so yeah, telehealth in a sense. Now, obviously, she was coming for a scan, so telehealth isn't going to work for that. But tell us how sonographers do fit into the picture of remote health.
So there's a few ways that sonographers can work remotely. But in my case and for my company, I work remotely as an advanced practice sonographer. And so we see images from all kinds of different locations, from big cities to very remote locations, in the middle of nowhere, Montana, to downtown Austin, Texas. We're able to get these patients MFM reads on their exams and help them get high level scanning, fetal echoes, 7, 6, 8, 11's detailed anatomic surveys uh, from the comfort of their doctor's office instead of having to commute to who knows where to have these high level services performed. And
So
so as a sonographer, how do I fit into that picture? We help the sonographers there on site. We train them in performing these more detailed exams.
so you do training.
We do some training, yes.
Okay.
A lot of folks just need a little bit of coaching. They've got the basic things there, but here's, the views you need to add, and here's how you obtain those views. Here's what they should look like. A lot of folks do really well with just that amount of coaching, but we do offer in-person training if it's needed.
So that's part of your job as well, then, is to
Yeah.
train and talk with other sonographers in addition to reviewing images and setting
Mhm.
up the report for
Yes.
the physician to sign off on.
Yep. Once sites are up to speed and they've been trained and acclimated with physician expectations and protocols and things like that, the vast majority of our job is doing exam review and just making sure that reports reflect what is in the images, or things that are suboptimal, mark suboptimal. Oh, there was a circumvallate placenta. Did we say that in the report? Those kinds of things.
Okay, awesome. Yeah, so your next slide, you talk kind of about the road to APS, right?
Mhm.
And this is probably a little bit of a hot topic, right?
Yes.
I think we'll eventually get to credentialing with this in the long run. But it's important to state at this time there's no official credentialing for that. And so it's a title that your group of physicians gives you, correct?
Yes. Yes. And I think it is important to say that, if you're an echo sonographer, that you can get formal APS, ACS credentialing at this point. But outside of that, there's nothing formal offered, no official
At this time.
titles.
At this time, right?
Mhm. Yep.
I think it's a work in progress, and it's come
Yes.
very quickly, I believe. So
Yes.
that would be
Yes. I found articles dating back to like 1991. And so I'm like, we've been talking about this for how long now?
for quite a while, right?
Yes.
So you have an ACS1 pathway and an ASC.
Yes. So those are the pathways that are offered from Cardiovascular Credentialing International for echo techs. And so, if there was a similar situation for general sonographers or for OB, MFM sonographers, that would be pretty fantastic. But, for these cardiac sonographers, there's actually programs out there for them to attend that are credentialed. And all they have to do is pass this program and then they're able to sit for their test.
That's awesome. Yes. And we've talked about a few other programs that are kind of in the works, pilot programs in San Diego and different ones of that
Mhm.
um, that are well on their way to getting us
Yes.
goals for that. Maybe I'm jumping the gun. Oh, I think I am. Okay. So, how do you become an APS, advanced practice sonographer?
Well, different organizations have different needs, and definitely have different job descriptions for what their advanced sonographer or advanced practice sonographer might do for them. Obviously, if you're working in person, your job description is going to be very, very different from mine. But a general APS job description would include high-level scanning. Obviously, if you're working remotely, you're not doing that necessarily. You would be reviewing high-level scanning exams. Um, Training staff, like preceptorship, or possibly in lieu of an educator or hand in hand with an educator. Exam oversight, QA, making sure staff are following protocols periodically, checking in with everyone and those things. Image review QA, education for your department, if your department doesn't have a formal educator. I know some big hospital systems are kind of trying to shift from just that educator to making educators these APS, so making them do it all essentially. Um, Probably as a money savings for them. But also doing accreditation for your department. That could be a duty of an APS. And then any additional duties as needed, which just translates to anything your docs need you to do.
Prepare a PowerPoint for them,
Yes, be the bad guy for whatever situation. Yes.
Right, right. Right. Yeah. Right. So let's talk about compensation of this. I am curious because it is a new position. And what's that kind of look like?
There's different ways an APS could be compensated, um, and certainly different price points depending on where you live probably would make the biggest difference. If you live in California and you're working in Los Angeles as an APS, you're probably going to be making a lot more money than someone doing the same job in, Florida, for example.
Right, right.
So a lot of APS are paid a salary. Some APS, especially folks who are doing case review, which is my case, are also being paid by case with a stipend for by case pay. There's people who are paid hourly. I know someone who was an educator and has been transformed into an APS, and they're making roughly what they were making as an educator. Um,
That's
but
interesting.
yeah, so in my current pay model, I've got a base salary, which would be very low if that was your only source of income, right? But since we're also paid per case, that really is where the bulk of our income comes from.
Yeah, that's interesting. I have also heard that APS are making about what like a midwife or a PA would
Mhm.
make in other fields. So that might
I
be a
think that I think that depends on your working environment for sure. I would say that for a starting pay for an APS would be really close to what the top end of the pay end would be for a staff sonographer.
okay.
Like if your top end was 65 an hour for your staff sonographer, the APS might start at 66 or 67.
Huh. Interesting. That feels a little low.
Well,
Really,
working remote though,
it's a
if you
lot more, well, unless you're working remote. Yeah, I guess I imagine an APS on site, right?
Mhm,
Assisting the physicians
mhm.
with their work.
Yes.
And then you're much more hands-on and much more involved in
Yes.
the work as opposed to being remote,
Yes, and for that, it would make much more sense for you to be paid the equivalent of someone working in a nurse practitioner or PA role. Absolutely. There are hidden compensation facets for when you are working remotely, though.
Okay.
You're not paying for gas, you're not paying for wear and tear in your car, you're not paying for scrubs. I can just show up to work in boxer briefs and a wife beater and no one's gonna know.
Right,
So
right. That's true. So you don't have to get online with anybody, right?
right. Um, Lunch in the cafeteria. I'm not paying for that anymore. Not getting Starbucks tea once a day. So like instantaneously, that's like a $8 to $10 savings per day.
Yeah,
Um, just for that. I'm not having to get new shoes every 2 months. Like there's all kinds of kind of unwritten savings.
right. So where can you find opportunities for remote work for sonographers?
There's lots of different opportunities out there right now. I will say right up front that a lot of these remote opportunities are recruited or posted internally and never posted externally.
Right,
And that's because there's a high level of trust that has to exist
right,
between the reading physicians and the APS staff.
right.
You kind of have to know, if someone dodges, are you going to dip? Are you also going to dodge? You've really got to kind of have seen this person under pressure, know that they're an efficient worker, know that they know when to ask for help. But that being said, there are other opportunities besides just working as an APS. There's folks working in telesonography, which is pretty cool, which has applications in pregnancy. It has applications in fertility. It has applications. You were speaking about your um, future guest who helps provide maternal care for
Other,
lower, yes, for lower gross domestic product countries. I know some folks who have set up programs in like remote South America, and they've trained them how to just take sweeps and volumes, and then they review them from here in the United States and help these folks, get some diagnoses before birth to know, are they good to deliver in this village, or should they see if they can find a way to get to a city?
oh,
Um,
wow.
so there's lots of cool opportunities for remote work in telesonography. There's lots of hybrid remote programs for educators, for research. There's also folks who work in education, who teach remote sonography programs full time, or again hybrid remote. So lots of different niches out there. PACs folks, people working for software companies, people working for GE.
Right.
Lots of stuff coming up.
So tell us about your typical day as a advanced practice sonographer then.
Sure. My typical day is definitely mostly spent reviewing cases. Amongst our team, we have like blocks of being on call split up, but we're only on call during our working hours. We're not on call after hours, nights, holidays, weekends, none of that, just during working hours. And so we occasionally have to respond to requests for, emergent situations. We respond to requests to review exams essentially real time with sonographers to find out, do they need more images for this patient? Does she need to wait for the physician to read this exam before she leaves? Things like that. But vast majority of my day, probably 95% of it, is spent doing case review, report prep for those cases. Billing, we log billing for every patient. We log relevant findings or abnormal findings for every patient for research purposes.
That's super.
I sometimes do like a little bit of tech support. I would say that's not my strong suit, nor is that in my job description, but we do end up doing some of that with folks, or at least telling them, hey, okay, I can't help you with this. You need to call your own, service engineer, etc.
That's awesome.
We
And
also
so,
take all of the communication essentially from these referring sites on so that our docs don't have to, take the time to respond to a text asking where's this report or, whatever.
okay,
So we act as an interface for our locations for
okay,
the docs. Obviously, if a doc needs to talk to a doc, they should call each other, but
right.
pretty much everything else we take on for them.
So how do you get a hold of the patient's history then? Do you have access to their system, or how does
We
that
have
work?
access to EMRs for some locations. Obviously, a place like a birthing center might not have a full EMR system. So then in those situations, we rely solely on what the sonographer provides to us. And if we have questions, we'll give them a call or shoot them a text and say, hey, I don't see an indication for XYZ. What is it?
Okay. Awesome. Yeah. And so you're very active with the sonographer then as APS in reviewing and logging and educating and encouraging kind of.
Yes. And even if it's something just like, hey, the echo was so pretty, you did a fantastic job. Like anytime I see something where they clear it all of something, I like to try to give them, at least a thumbs up on it and say, hey, you're doing good work.
Right. Positive feedback is always welcome. And I think it really builds trust too, I worked for a physician who was just really hard on everybody. And I can appreciate that, right? We all want to be better, right? But if there isn't the positive with the negative, it really just kind of almost
Yeah.
causes a resentment.
Yeah. It's hard to get used to no news is good news kind of a
Right.
thing. But
Right. Unfortunately, that's what the society we live in, though, right?
I think so. And trying to teach that to new sonographers, like they didn't say anything to you, that means you did everything right. Like and
Yeah.
trying to turn that switch in folks' minds.
Right. Right. Right.
It's not the
Not
same as
to have
hearing
to
it from
be
someone's mouth.
not to be dependent on it, right?
Right.
But it's helpful. It's
Right.
a small extra mile kind of a thing,
Yeah.
right?
Is it as good as hearing it from their mouth? No, but it
Right.
helps me get through my day.
Right. Exactly. Exactly. So how would patient satisfaction scores really be affected by some of this?
So in the bulk of our locations, these folks would not have access to MFM otherwise. And so just saving them commuting time, saving them money because they're able to stay at work however much longer, instead of having to, then drive 2 hours to go to see an MFM and they only have to drive 10 minutes instead. Saving them money in daycare for these same things. Typically, our patients are very, very satisfied. We've done a few studies internally in our organization and publish the data. Average miles saved for our patients in Montana specifically, 204 miles per visit, which equates to roughly 200 minutes of time saved, just on the commute alone.
Or
Um,
longer. Yeah, but yeah, Montana. Yeah.
Yeah, and so our docs utilizing tele-MFM services and doing face-to-face visits for a lot of these patients in conjunction with the ultrasound reads. Typically, patients are pretty satisfied with that. And the majority of patients report that they don't feel like they're missing out on anything without having actual, skin-to-skin contact, if you will, if you do
Right.
that with your doctor. Um,
Handshake, maybe.
sure.
Although nowadays that's kind of frowned upon in some places, right?
Right.
Still because of the COVID. But yeah, and in New Mexico, I think you reported a 95% patient satisfaction. So
Yes.
um that's amazing.
It's huge. Yes. And New Mexico is one of the states where they have been kind of really pioneering telehealth visits for pregnant people specifically. And seeing the results coming out of New Mexico are really, really promising. And the efforts that folks in Santa Fe and Albuquerque are making to really get to these remote parts of the state, it's really awesome.
That's amazing. That's awesome. So do you have training, like a YouTube training, or do you have your own training that you've created for sonographers? Or
We have an initial meeting with sonographers that we typically schedule for 2 to 3 hours where we go over protocols. Um, and then if they have questions about the protocols, let's say they weren't doing 811 exams, they were doing 805 exams. So we have presentations prepared that we kind of say, okay, these are the differences. Here's what it should look like. Here's how you do it. Um, And then we follow back up with them after they're performing it. We don't like to badger anyone.
Right.
And some people don't want a ton of hands-on. So we kind of like to try to give people space to breathe and work and provide feedback when it's important, if it impacts patient care, or if it's repeat mistakes. But we do have kind of an initial walkthrough with folks, and opportunity for them to ask questions.
Awesome. Awesome. Well, this is amazing. This is the new technology and where medicine is really kind of taking us. This is probably one of the biggest changes and swings in medicine in a long time, as far as the way we care for our patients and communicate with them. And so it's kind of exciting. It can be a little frustrating. I know I do speak with one doctor. And so the whole finding a safe like HIPAA and a safe place to talk online with your physician, I know. And so they use certain
Very specific messaging programs, very
right,
specific
right,
um,
to keep that
telecommunication. Yes,
right.
yes,
So I think sometimes that can be a little challenging for patients to log into. And I mean,
yes. Especially when everyone has their own and they're all
right,
different. Yep.
are all different. And I feel like I'm pretty tech savvy. I'm not like the best, but I can somewhat troubleshoot things, right?
Yeah,
And-
I feel like as I get older, I struggle more.
right,
But
right.
I feel like if I
Exactly.
can't figure it out, then but like who can?
Right. But it's just nice to have that as an option. It takes a little longer to get connected and different things, but I think with more people getting used to that and being familiar and know this is how it's done now,
Right. And
it,
the younger generation kind of coming up with this as a baseline, so they're ready to build from here.
right. Right. So, yeah, and then AI is coming along and I'm kind of excited to see how that is going to help and change our platforms, right?
Yes.
And
Yes. I can just instantaneously see applications for that in general ultrasound. I think it's going to be a little tougher, not that it can't happen or won't happen for OB, but I can
well,
see.
GE's brought out a new AI and I've kind of played with it for a little bit. And I think if you get used to it, I think it would really save a lot of time,
Yes.
and button clicking and different things.
Yes.
Get
And
them
once
down.
you learn, what it sees, like how it's going to measure things, I think it really can speed you along.
Yeah. And so yeah, it's kind of fun to see where it's taking us and where we're going and still needing us as the human input, right?
Of
Still
course, and
needing
even
human
in my
input.
application, I couldn't do it without the wonderful sonographers that we have on site.
Yeah. So that's exciting. I'm excited to see where it's going. I'm excited. Thank you for sharing about your advanced practice sonography and different applications that is. I think sonography in general is just gonna go through the roof and explode, hopefully, with all these new applications and new possibilities. So
Absolutely.
I
And to speak
appreciate
to our point yesterday, I feel like I'm still preceptoring folks. Like I feel like that's the bulk of my job, and that's what keeps me interested. Helping these people be more satisfied with their jobs and their careers and more confident in their abilities. So
yeah, and help learn interpersonal relationships. I think that's a really huge part of our job. I was in a Christmas party the other day and a person was expecting, and so she was asking questions, of course, and all sorts of things. And it's interesting, the expectations that patients and people have on us. And
for sure.
so I'll hopefully do a podcast on that
I
here
was
soon.
about to say that's its own topic.
Yeah, yeah. A gentle, I'm trying to figure out, I definitely putting some thought into it because I definitely understand from the patient's point of view, but I also want the patient to understand from our point of view,
Yeah.
the struggles and the other side of it, right?
Yes,
A
limiting.
showed up,
Yeah.
a cute young couple showed up 15 minutes late for their appointment. And he goes, it was just 15 minutes. Is that a big deal? Like, are you going to get in trouble? And I'm like, well, I don't know that I'm going to get in trouble. It just puts like, you're the first patient of the day. So like, if you're 15 minutes late, then I'm 15 minutes late for the next one and the next one. And so for them, it's like, oh, it's no big deal. And, for us, like time
Right.
is
How would they feel if they were sitting in the waiting room then for 15 minutes past their appointment
right.
time?
And by the end of the day, now you're half an
It's
hour to 45,
compounded. Yep.
unless you've got some cases that you can catch up on, So, it's interesting, their perspective, right? And so not wanting to discredit anyone's experience, but just hopefully setting up expectations, for people in both as a sonographer and as a patient,
And how you as a sonographer can help set those.
Right. Right. Like you're in control of the space in the room and the time, you know. And when patients show up late and then they ask for 3D imaging, you know, I we address it. We just say, well, we're a little short on time. I'll see what I can do, and hopefully baby will be in a good position. But because we're short on time, I'm not sure I'll have time for that. So, um, and learning how to address it appropriately. So anyway, thank you so much for your input again and your expertise on this area and your research. And we hope this helps those who are listening. Thank you. One last question I forgot to ask yesterday, and I hope I keep remembering, but what is one thing that you do to increase your frequency? Like if you are kind of having a rough day or you're down, is there something specific that
Yep.
that kind of just you think of or you talk to or you turn on or you eat or
Yes.
whatever that just kind of gets you out of that funk?
Yes. I have a couple of things. And I can do them at the same time actually, but the big one for me is I like to make matcha. Like whisk it, boil the water, whisk it, and froth some milk and put it all together. I find that the whole process of doing that very therapeutic.
Okay.
And just the routine of it and then the reward at the end. For me, that will break up any, negative snowballing train of thought that I have. It's
Awesome.
it's an instant reset button. And in my fish tank, I can stare at the fish tank while I do that. So
That's
that's
awesome.
that's a brain checkout for just a moment.
Yeah. Awesome. Those are awesome. That's wonderful. Good deal. Well, thank you again. And we hope to talk to you again soon or see you on the stage of STMS again. And and go and or crunch time, right? And we'll go from there. So thank you.
Thank you.
Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.